Acupuncture is a form of traditional Chinese medicine that has been practiced for centuries. It is based on the belief that there are energy pathways, meridians, in the body that become blocked or unbalanced. By inserting thin needles into specific points along these meridians, acupuncture is said to unblock or rebalance the flow of energy and restore health. Acupuncture is generally considered safe when performed by a trained and licensed practitioner. However, there are a few things you should know before your first treatment. Today, we're discussing 7 things to know before your first acupuncture treatment. 1. Wear comfortable clothing. Your provider will likely need to move your clothes around a bit to find the acupoints that will help you. Most of the points we use are on the extremities, so a good rule of thumb is to give your provider elbows down and knees down. For example, a t-shirt and shorts or gym pants and a tank top are both great options. 2. First appointment is always the longest. This is because your doctor will need to check your health history and ask you some questions. This helps the provider understand your health and the underlying problems that are causing your symptoms. The first meeting will usually last between 1.5 and 2 hours. After that, follow-up visits will not need to be as long. It is normal for a return visit to take about an hour. 3. Bring your prescription information as well as any test results. Many people find it easy to just put all their prescriptions in a bag and bring it with them to their appointment. However, if you don't want to do that, you can just write down the name of the drug, dosage, and frequency. Additionally, test results can be useful in diagnosis. So if you have an X-ray or radiology report, bring that along as well. 4. Palpation and orthopedic tests. When you palpate someone, you put your hands on them to find out what's wrong. So there will always be some palpation in acupuncture because the provider has to find the points before they can be needled, right? They will touch you to figure out what's wrong. There can be some kind of medical massage. When you get acupuncture, you will always be touched. For example, let's say you go to an acupuncturist because you have pain in your shoulder. It's very likely that they'll start feeling around the area to see if they can find anything strange. And they'll probably want to know if they hit a spot that hurts a lot or if it makes you feel the same way you've been feeling. That is a very important point. If they want to figure out which parts of the tissue are the problem, they may also want to do some orthopedic tests. In the case of shoulder pain, they may want you to do the Healthe test, which can tell them more about the supraspinatus muscle of the shoulder. After all of that is done, and the provider has all of the information they need, they can start making a plan for treatment. 5. Find a comfortable position. The provider may ask you to lie face down or face up. In some cases, you may remain seated in a chair. Once needles are in, don't move from your treatment posture. To lie still, find a comfortable position. Tell your provider if you need adjusting before they needle you. Maybe you need more cushion, a bolster under your knees, or you can't sleep face down due to sinus problems. When you're face down and an acupuncturist needs access to your back, you partially disrobe. If you come in with shoulder or back pain and they need access to your posterior, they may ask you to remove your shirt and lay face down on the table. They'll cover you modestly. If the provider asks you to do anything you're not comfortable with, say so. 6. Pulling the needles. Once all of the needles are done cooking, the provider will come back into the room and take them all out. As we finish up, we'll often go around and press each point with a cotton ball. This just makes sure that no bumps happen. It's normal for there to be just a little bit of blood, but usually that's all there is. 7. Go about your day. Take your time getting up from the table after your acupuncture session is over. Some people feel dizzy when they stand up, especially if it's their first time getting acupuncture. This is because their bodies are not used to it yet. When you are in a deep state of relaxation, your blood pressure goes down. Then, when you get up and start moving around, your blood pressure may not be ready for it, and you may feel dizzy. So take your time and maybe sit in a chair for a bit before standing up. That's all for today. If you like this video, please give it a thumbs up. And if you want to hear more videos from our channel, subscribe and make sure to turn on the bell icon.